So approximately 30% of all new cancer cases diagnosed in women this year will be breast cancer. That's according to the National Breast Cancer Foundation, which estimates there is a new diagnosis every 2 minutes. Wow. The Dr. Scot Ackerman with the Ackerman Cancer Center is joining us here this morning. Good morning. Thanks for being with us.
Morning, Jim.
So last week we focused a lot on self-examination and some on mammograms in terms of catching breast cancer early. I'd like to focus a little bit on family history because I think that sometimes people think, well, I don't have breast cancer in my family history, so I must be okay. But the reality is there's a real connection between cancers because, for example, if you've had a family member with ovarian cancer, you could still be at risk of developing breast cancer.
So family history is very important in all cancers, and especially in breast cancers. We've always known of something called the hereditary breast and ovarian cancer syndrome, HBOC, and we knew about that before we were able to identify the genetic malformations that would make one predisposed to breast cancer. And that hereditary breast and ovarian cancer syndrome was identified in that it defined patients or families where there was an increased incidence of ovarian and breast cancer in multiple generations. And so we know women who have a mother or an aunt who's had a history of breast cancer or ovarian cancer, or a sister, I guess, are at higher risk of breast cancer. That being said, however, we've only identified in all the breast cancer patients that are diagnosed, only about 10 or 15% have an identifiable genetic mutation that predisposes them to breast cancer. But the key word is identifiable. There's a lot that we don't know, a lot of mutations, genetic mutations that are out there that we haven't really identified yet, that we think also might make a woman more susceptible to breast cancer.
Which is why it's so important to ask questions and make sure you know what your family history is and then share that information with your doctor. So if you need to be referred to an expert, that happens. Once it's identified that perhaps that you do have family history, what should that person then do? I mean, they may need to be screened early, right?
Right, so if you have the genetic malformation, that's one thing that puts you at a significantly higher risk, but just having a family history puts you at high risk. Yeah. So if you're in those high risk categories, you want to be a little bit more, you want to stay on top of your breast cancer screening a little bit more than someone of normal risk. So we normally recommend that a woman gets her first mammogram at the age of 40. If someone who's high risk, we recommend to get it at the age of 35 or even younger in some situations that are very high risk. We certainly recommend that women who are high risk with a family history or genetic predisposition to breast cancer, make sure they do their breast self-examination on a regular basis every month, and see a physician once a year to get a professional breast examination. So those women at high risk need to be aware of it and make sure they do their screenings properly, not just for breast, but also for ovarian cancer.
So you brought up mammograms, which is, I think, such an important point. You know, if for women who've maybe not had one yet because they're just reaching that age, there are different kinds of mammograms. Which ones are best for? Because they're not one size fits all.
Right. So for years, we've been doing what's called a 2D mammogram. That's just a picture of the breast taken like this and taken like this. It's an X-ray picture, very low dose X-ray. And over the years, what's evolved is that we're able to do much lower doses of radiation in those so that we don't give too much radiation over the years will cause breast cancer. And then a few years back, we developed something called 3D or tomotherapy. Tomo mammogram. And what that is 3D. It's able to see slices of the breast like a CAT scan does. So you take a picture, but the image is able to get different depths within the breast, and we can identify cancers much more easily with that. And that's the 3D, and that's pretty much what's done almost everywhere now. And the latest that's really cool, I think it's really cool, is something called contrast enhanced mammography. And that's where we do the 3D mammogram, but we also inject contrast just like we would in someone getting a CAT scan. And this image that's up on the screen right now shows it very nice, that you can see very easily on this contrast enhanced mammogram that on the patient's right breast, which is the one on the looker's left, that's right, but you can see that area that takes up that extra enhancement there, and that is a breast cancer in that breast.
And is everyone a candidate then for the contrast enhanced mammogram?
No, you know, if certainly women that have a contrast allergy wouldn't be appropriate for it. It also takes longer to do. And so I think that we're recommending it right now as a diagnostic tool in those women that are at higher risk.
Dr. Ackerman, thanks for your time this morning. We
Thank you,
appreciate it. So important given the fact that this month is Breast Cancer Awareness Month as well.